ambulance service. Is the patient breathing?
He fell down. He can't breathe. He's not wake up.
Asthma attack. She's struggling to talk.
She's gone all very funny. She don't know where she is. She's just lay here all mesmerised.
Starts in the morning, eh? I know.
We're on board with the paramedics of West Midlands Ambulance Service.
This job changes every day.
Can we get fire or police, somebody with bolt cutters?
Pay for even when I'm pressing here.
Saving lives and making a difference every day.
You say the patient's been stabbed?
In a medical emergency,
You all right?
6 million people rely on them.
You can go to people giving birth, then in their most traumatic time of their life.
You could be having a bleed on your brain.
OK, mate, move in.
Filming simultaneously with 7 paramedic crews.
Got loads of things going on.
Take steady breath for me.
Capturing life on the front line.
There's no price you can put on saving somebody's life.
Good morning.
Good evening.
Good afternoon.
Good night.
It's tea time in the West Midlands. But for the paramedics, 6:30 p.m. signals the start of another busy night shift.
You done much today?
Not a lot.
No.
Slept. Went to the gym, innit?
Nice.
About it.
That sounds
About
good.
you?
I went for an ice cream
Oh, nice.
by the river.
What flavour?
Oh, I went boring and just went for vanilla.
Can't be an old classic.
As the sun sets, thoughts turn to retail therapy.
Do you prefer shopping online or in person?
I think because I'm a weird size, I've got to try things on, I've got to see if it fits nice.
Yeah.
I think the mirrors in the changing rooms
Oh, God, hate those
are
mirrors.
just wrong, but like they're not very good. They're not nice.
was
are
dark
they? They're
and-
not kind to you. They're not kind to me anyway.
I like shopping online. Amazon next day delivery for the win.
But I do prefer to go to the shop because I like to touch my produce. Have a good squeezy your melons, you know what I mean?
What words do you think are funny? Moist. That make you laugh. Moist is definitely at the top of the
Moist
tree.
phalanges.
Moist phalanges. Moist fingers. So where did you get the moist phalanges from? Where's that origin?
I don't even know. I think it's just a really, it's just a different word. Phalanges.
Funny
It's just
word.
a funny word. And
There
then
are
moist.
funny words.
Like so many people hate the word moist. And it's just a great word.
What word did you find funny? Bin juice. Really funny.
Ambulance service, is the patient breathing?
Yeah, it's nearly breathing, but it's very, very bad.
What's the reason for the ambulance?
He fell down. He can't breathe, I think. He's not wake up.
4829.
Just ahead.
2992, up to the second one. I'm a sorry, baby, she's not breathing. I'm not really sure what's going on.
That's honestly.
She's got an unknown location, but it's saying that he's outside.
That's fine. We'll go and have a look. Many thanks.
This could be interesting.
I quite dislike jobs outside.
Yeah.
I think it's always a bit tricky, isn't it? And there's potential for a lot of people getting involved. And
Yeah. Much rather it be light.
yeah, or just get them in the ambulance as quickly as possible.
It's a Saturday night, anything could happen.
Yeah. Just
Corner.
here.
Yeah.
Yeah.
Hello.
All right.
Hiya.
So this gentleman here is a friend of
I'm from the floor.
He's staggered across the street and seemed to hit his head on the wall over there. He's got a gash on his
Yeah, I
head,
can see the bump.
Okay.
which you can see.
When the patient fell hitting his head, his friend called 999. Community street pastors are also with the patient.
Has he lost consciousness at any point? Just completely knocked out.
Okay, have you got a headache? No. Should we get you off this floor, maybe?
With a potentially serious head injury, Lisa and Danny need to examine the patient in the ambulance.
Let me just have a feel of your head a second. Keep your head nice and still for me. Have you got any pain in your neck at all? Don't shake your head for me. Keep it nice and still. Just answer yes or no. Any pain? No. No neck pain.
After checking the patient's spine, Lisa and Danny are happy for him to stand up.
Not that you're aware of it. We're vomiting. Oh. All right.
But as soon as he does, he's sick.
Let's take this off a second, just get this out of the way.
How much have we had to drink tonight? Quite a lot. Yeah.
I've never seen you like that.
No. How are we feeling now? We're still going.
It can be quite concerning when somebody does vomit, especially when they've potentially got a head injury. It is quite hard to tell, are they just vomiting because they've had too much to drink, or are they vomiting now because they've hit their head? So it can be quite a red flag.
Do you want to try and sit up a little bit?
You want to try to see them?
Yeah.
Ready, steady. That's it, the stretch is just behind you.
It's nearly 2 a.m. in the centre of Worcester. For this patient, his night has ended badly as he's stretchered onto the back of an ambulance.
There we go. Can't go anywhere now.
Oh, God.
Oh,
You're all right. Don't worry.
Just gonna pop this under here a minute, just in case you're sick again. Okay.
Ready?
Yeah.
Bit of a clunk.
Oh, there we go. Let's have a little look at this.
It's quite
an egg, isn't it?
quite swollen, yeah. So he hit his head off the wall.
Yeah.
Yeah.
Right.
And then lost consciousness straight away, and then
Where are
been
your
in and
hands?
out of consciousness since. Okay.
What's your tipple of choice?
Whiskey.
Whiskey, blimey.
There we go. Thank you.
Do you know what you're on at the moment?
Whiskey.
Whiskey.
Oh, the whiskey vehicle.
The whiskey vehicle. Yeah, you're in an ambulance at the moment. Well, it's very difficult to tell whether your condition is because you've hit your head or because of the alcohol or a combination of both. Okay? And you've started to vomit as well, which again could be a sign of your head injury, or it could be because you've had too much whiskey. I know. But the problem is we don't know. The risks of going to someone with a head injury that's intoxicated can be quite a challenge. The alcohol itself can thin the blood, which can cause a high risk of a bleed around the brain and increase the pressure around the brain. So it is really quite important that we get him to hospital as quickly as possible.
I don't like baby carrots, they're really weird.
Baby carrots?
Yeah, you know, the little mini.
Yeah.
I like raw carrots, I don't like cooked carrots.
Yeah, I've got to have them cooked, I don't like them raw.
I don't like them raw because they're too squishy.
Yeah, see, I've got to have them soft.
They don't taste like normal carrots.
Baby carrots?
No, like you
What,
get,
if you cook
you've
them?
got, no, like, so you've got like a little bag of baby carrots and then you've got, I'm very...
Carrot
obviously-
sticks?
You've got like a normal carrot that you've like, what's the word? Grated, not grated, got the skin off. And then you've chopped it into sticks. Stop laughing. You've chopped it into sticks and then you've got a bag of like those tiny little baby carrots. They don't taste the same. You eat a raw carrot, it tastes beautiful. You eat a baby carrot, it tastes like...
I thought a raw carrot and a baby carrot was the same, just smaller.
I'd eat a carrot stick with a bit of hummus.
No, don't think so.
Ambulance service, is the patient breathing? Yes. What's happened?
My partner suffers with a pain condition called sphincter body dysfunction, and she's been having a big flare of pain for the last couple of days.
Where's this pain?
It's in her back and up through her chest into her right shoulder.
So we're going to a 34-year-old female. She's disabled. She's got something called sphincter of body dysfunction.
That's around the bile duct, isn't it?
She uses a wheelchair. She's having a flare-up of this condition she's got?
So the sphincter oddity is a valve in the digestive tract. It passes bile from the pancreas to the small intestine.
If it's blocked and it's not working properly, then you can get quite severe abdominal pain and can cause a lot of discomfort, a lot of sharp pains in the stomach.
It might be just assess the situation, see if we can give pain relief or do what we can.
Upstairs and to the right.
Lovely.
Is it Charlotte?
Hello, sweetheart. All right.
Charlotte has sphincter body dysfunction. It's like a pain condition after having a gallbladder taken out, and she's been having a bit of an attack of pain for the last couple of days.
Mum of two Charlotte has a rare condition that causes severe pain in her abdomen. Tonight, when the pain became unbearable, partner Greg called 999.
She's already had all her normal medication.
And has it just been the pain's been getting worse since it started a couple of days ago? When I first saw Charlotte, it was obvious to us that she was in a lot of pain. So next steps were to make sure that her observations were okay and treat the pain that she was in. And on a scale of 1 to 10, 10 being your arm ripped off, 11. Well, Courtney's got a bit of the gas and air. You've had it before, I'm assuming. How's your eating and your drinking been today?
She hasn't really eaten much in the last few days because it's a condition that is a bit like the pancreas and everything. When she eats, it can set the pain off work.
Yeah.
Well, if you want to grab that for us, don't worry about the wires. If they come off, they come off.
The actual sphincter of oddity, Charlotte doesn't have anymore. They cut it out completely.
But it's
which
still
was
the
like,
effects she gets.
Yeah, it's still the nerve endings around it that still causes the spasms and the pain.
Charlotte's pain is made worse when she eats, so she also uses a feeding tube.
You could clearly see she was in quite a lot of pain, and she'd left it quite late to call us as well, didn't she, to receive help because she wants to try and manage at home on her own. She's a young mother. It's life-changing, really, isn't it? You never know when you're going to have a flare-up.
It's such an unpredictable thing. Would it be okay if I try and pop a needle in your arm and see if we can get some morphine? Is it okay if I have a look in that other arm? You've got nothing worthwhile in this one. You just don't want to give me anything, do you?
Can we have a look at your feet?
With Charlotte's veins proving difficult to find, Parker and Courtney try a different approach.
And we'll pop this around your ankle and see. But no, nothing palpable really.
Just gonna shine a light.
It's just nothing.
Got one there. 9 times. Just try.
But even in Charlotte's feet, Parker and Courtney can't find a suitable vein.
Can we put the light on? Is that okay?
Yeah, it's just behind you.
Let Courtney have a look. If you get something now, I'll be so mad. Charlotte was in a lot of pain, so we did offer her oral morphine. However, it doesn't work effectively for her, so there was a lot of pressure to get a needle in her arm to give her some intravenous morphine.
Do you want me to try? Yes, please. I think it's got one tiny one. I'll try that. All right, sharp scratch. So I'd like to take you down to the hospital. Are you okay with that? Yeah? Okay.
In Worcester, paramedics Danny and Lisa are treating a drunk patient who's fallen and hit his head.
Just taking a picture.
You got any pain behind your eyes? No. Just in that side of your head? Yeah.
Can you open your eyes for me? Open your eyes for me. Oh, thank you. Do you feel dizzy?
I've got nystagmus. When we were assessing this patient, he did have a very slight, strange eye movement, which is what we call nystagmus, which is where the eyes flicker from side to side. So this could be a red flag sign of a head injury.
I'm going to give you a little bit of oxygen just because you've had a bump to the head, okay?
Just put my head up just for a second. That's it.
That's it. Nice and relaxed with this arm.
With a head wound, vomiting and unusual eye movements, Danny and Lisa are keen to get their drunk patient to hospital.
Good evening, Worcester. It's Lisa on 4829. Yeah, I've got intoxicated head injury. The reason why I'm alerting though, yes, he's less alert, but he's also got some nystagmus as well. He's not behaving his normal, occasionally a little bit agitated. Okay, see you in a bit. Bye-bye. Okay, don't pull that off. Oh. Yeah, okay. I think I missed all of that.
The patient is still clearly very unwell.
Can you lift your head up for me a little bit?
Sorry.
It's okay.
After a 4-mile drive, Danny and Lisa arrive at Worcestershire Royal Hospital.
You ever been in a situation like this?
Well, I've had a few too many sherbets before, yeah, a few times. I've not ended up in an ambulance, though, with it.
I think people really underestimate how dangerous alcohol can be.
Yeah.
I don't think they realise how much it can thin your blood. If you hit your head, you can potentially end up with a brain bleed. There's just so many complications that can come from a bit of alcohol.
It's really difficult. Well, people want to go and have fun, but I think it's just got to be within reason.
Yeah.
So there's quite a lot of vomit poured down.
I got all down my leg as well.
Sorry.
It's okay. Don't worry.
We'll let you off.
Yeah.
In A&E, doctors will want to find out if his symptoms are caused by a head injury or simply too much whiskey.
I think it was the nystagmus as well, with his eyes just flickering.
You can't ignore that, can you? And is that because of the alcohol or is that because of the head injury? And it's not really a risk that's worth taking on that.
You're doing really well, sweetheart.
In Wolverhampton, paramedics Parker and Courtney are treating Charlotte. She has a rare and painful abdominal condition called sphincter of Oddi dysfunction.
Don't you dare.
Don't blow it, no.
Parker and Courtney need to get Charlotte's pain under control, but finding a suitable vein is proving difficult.
There you go.
How dare you even get that? Fair play.
How good is Courtney at cannulating?
She's all right.
She's all right. You're just jealous.
Yeah, you're very good at cannulating. It just is the way it is, isn't it? You've had a lot more experience.
Okay.
You're a couple of years.
You were really proud of me when I got it in now.
Right, just put your pain relief in now, sweetheart.
You're doing really well, sweet. You've got the first bit of that morphine going in anyway, so that should start to help a little bit.
Sphincter of Oddi dysfunction.
It's life-changing, isn't it? It's
changed my life.
drastically.
A normal person, someone who doesn't believe
Quite limited now.
Yeah. A condition like sphincter of Oddi dysfunction can be so debilitating, especially for Charlotte being a young mum. She can't do things that a lot of regular young mums would be able to do. She's housebound, so I can imagine it's very difficult for her. Are we still at 9 or have we gone down a bit? A bit more. So should we say 8 or 7? 7. Oh, lovely.
With the pain relief starting to take effect, Parker and Courtney can begin to move Charlotte.
I'll take this off you. I think you just need to be very careful with that hand.
I know. Please don't lose my amazing cannula.
Honestly, she deserves a tip for that one.
Charlotte needed to go to hospital because her symptoms couldn't be managed at home. So she was in quite a lot of pain. She'd already taken her own pain relief and it just wasn't working.
Is there anything that we can do to give you a hand as you go down the stairs?
Just hold my hand till the raining, that's all at the moment.
Okay. It was difficult getting Charlotte to the ambulance as she usually uses a wheelchair. There was a lot of tight spaces, and we also wanted to make sure that we'd kept the cannula in place, as that was our only option of giving her pain relief.
So get your bum up as far as you can in the crease, all right?
And then swing your legs over.
So swing your legs up, darling. Do you need a hand?
You've got it. Oh. Little click. Would you like a bit more of the morphine now? Is that okay? Yeah. Yeah, of course you can.
With Charlotte and Greg on board, Parker and Courtney set off for hospital.
What made you realise it was sphincter body?
It took a long time to diagnose what it actually was. She had keyhole surgery and they found cysts on her ovaries.
Okay.
She went back in and took her gallbladder out. And then she's never got better from that.
After 30 minutes, Charlotte arrives at Sandwell General Hospital in West Bromwich.
Happy?
Whenever you are.
Here, doctors will investigate why her rare condition has got so much worse tonight.
Come prepared with a pillow.
I literally said that. I was like, he knows what he's doing.
It's a shame that, that's the thing with long-term conditions. She said it's been life-changing, literally from the day she had her gallbladder removed. She got really good support from Greg.
I love Greg. Greg's my new best mate.
Hitting the wall now. We've hit the wall, it's the time of day. I think it's this time in the morning when you think, why the hell am I doing this job?
It's something I think about quite often, how much money I'd pay.
To go home to bed?
Yeah. I sometimes think, would I forfeit a month's wages to go home now?
No, you wouldn't, Neil. I know what you're like. You're pretty tight. Bloody hell, you wouldn't. No way.
No, maybe not.
Ambulance service, is the patient breathing?
Yes, but not good. He's 94 nearly. He's on the floor.
So he's had a fall, has he?
Yes. I can't get him up, you see.
Okay, so we've got 93-year-old male. Says fallen, having difficulty in breathing. When you hear a 93-year-old is on the floor, your first thoughts are, how long have they been on the floor and how badly injured are they? Gerald, that's his name. Gerald. That's it there. Is that it? That's the one. Hello, ambulance.
Oh, right.
Hello, sir.
That's the ambulance.
Hello, Gerald. My name's Neil and this is George from the ambulances. Good. How long have you been on the floor? Couple of hours.
When Gerald fell out of bed and couldn't get up, his daughter Susan rang 999.
So what we'd be worried about is how long your dad's been on the floor, basically.
Well, Caroline rang me. It was after 3. I was here within 20 minutes.
Once we get you up, Gerald, we'll maybe have a look at your back and the bits that are touching the floor, and we can kind of establish maybe how long he's been on the floor by colour of skin and whatnot. But you haven't hurt yourself anyway, just the bottom of your bum hurts a bit from being on the floor, yeah? Yeah. Okay.
So he had a new catheter put in on Friday.
Right.
He hasn't really been right since then.
He does feel very hot to touch because when he's on the floor, you lose quite a lot of heat through.
He was hot.
Yeah. Do you feel a bit feverish, Gerald, or not?
I've been a bit of a chest.
Yeah. Okay. Your daughter says you haven't been quite right.
I never was.
You never was.
Gerald's temperature was quite high. It could suggest sepsis, which can be fatal. The only way to tell that is through a blood test at hospital.
38.7.
You're burning up.
Across the West Midlands, we're following 7 paramedic crews as they work a typical 12-hour night shift.
I tell you now, Gerald, your temperature's quite high and your heart rate's high.
To the north of Worcester, paramedic Neil and technician George are with retired farmer Gerald. He collapsed this morning and has a high temperature.
I think you've probably got an infection because you've had a new catheter fitted recently, haven't you?
That don't seem right.
Yeah. What we're going to recommend is hospital.
Why today?
Yeah.
Being a farmer, they're normally very tough, aren't they? And stoic and...
I think for the generation as well, generally they're extremely stoic, aren't they?
Yeah, and don't like to call an ambulance.
No, don't like to cause a fuss.
Wiggle your toes for me. Okay. Any pain in your neck?
No.
No? Good.
Neil and George's first job is to get Gerald safely up off the floor.
If you lean right over, and Neil's going to wedge it literally right under you.
Okay.
Okay.
Yeah, bend in the middle then. This way up. Put your hand on my knee there, that's it, and I'll hold on to this. Right, we're going to go up in the air now.
An inflatable cushion is used to raise Gerald up.
Let's see how you stand up then, Gerald. Yeah, that'd be good.
Yeah.
Should we see how you stand then?
Yeah, you want me to stand up?
Yeah. Yeah. Right. Gerald, it sounds a strange question. Is it okay if I look at your bum? Just see how red it is.
Look at it, you like.
Generally, when people lay on the floor, they're normally very cold. In Gerald's case, he was actually very hot, which is unusual, which shows that he must have an infection or possibly sepsis.
When the body overreacts to an infection, it's called sepsis. It's a life-threatening condition that needs treatment quickly.
We're just going to swing. Ready? Okay. Oh yeah, that's it. Right. Right, let's put this on your arm. How's your breathing feel now you're up?
Oh, a bit better.
Bit better?
But it never was that bad.
Yeah.
It was chested.
Heart rate's all over the place really. We're going from like sort of 100 to like, and then it goes up to 179.
Gerald's heart rate was fluctuating quite a lot. This was a concern to us because has sepsis already set in, we need to get him to hospital quite quick.
Dad, I'm going home to put the dog out.
Okay.
I'll get you some bits and pieces, but I'll be up there as soon as I can, okay? All right, thank you so much.
No problem.
Thank you.
Susan will make her own way to hospital, while Neil and George take Gerald in the ambulance.
Cool, happy when you are, George? That bed's a bit more comfortable than on the floor, isn't it?
After 7 miles, Gerald arrives at Worcestershire Royal Hospital.
Let's go.
Doctors will quickly establish if he has sepsis and try to identify the source of his infection.
When I was doing his obs, he was on the edge of being an alert, really, because his heart rate, depending on how his heart rate was when you did the news score and whatnot.
And his breathing rate, yeah. He's quite a funny chap as well, isn't he?
Yeah.
Fairly jolly considering.
Yeah, I think you got to be, haven't you?
Yeah, yeah.
At West Midlands Ambulance Service, every one of these 999 calls gets answered, on average, within a couple of seconds.
Well, where are you hurting? Is it your arm?
At the moment, is the bleeding getting worse, staying the same, or starting to slow down a bit?
The paramedics may be the face of the service, but the call assessors are the ones making split-second decisions on who gets help.
We are the person that's hearing a mother do CPR on her 6-month-old child. We're there assisting a father deliver his first child with his wife. I don't think people appreciate that that's what we do. And we do that before the crew arrive.
Ambulance service, is the patient breathing?
He's breathing.
Is he conscious and awake?
He's not conscious at the minute, but there's blood coming out of his mouth, and he has been fitted.
He's had a seizure?
I don't know, we just found him literally unconscious.
Okay. So I've got an emergency ambulance arranged, okay, and I'm going to stay on the line with you until they arrive.
Recovering from a seizure, he could stop breathing completely. So we need to get those crews on scene as fast as we can.
It's on the sales area.
On the shop floor?
Yeah, well, there's a few of us. It's I'll have somebody waiting at the front doors as you walk in to take you straight there.
No problem, that's absolutely fine. So is he still currently unconscious?
Yes.
Yeah?
Snoring, though.
He's snoring?
Heavily snoring, yeah, and there's a lot of blood coming out of his mouth.
Is he bleeding heavily?
I would say, yeah, I would say bleeding heavily, yeah.
If he has another seizure, don't try to move him and don't try to open his mouth or put anything in it, OK?
Yeah, no problem.
And you said he's on his side. Remove any pillows or cushions from under his head for me, OK?
Remove them?
Yeah, remove them just to open up his airways.
OK. Okay. Just take the cushion off from underneath him.
The person on the phone was a big help. He was informative, he knew exactly what had happened, listened to what I was saying, and he was really big help.
OK, and just keep checking his breathing until the help arrives. Like I said, I am going to stay on the line with you until they arrive.
Because he just had a seizure, he could have gone into cardiac arrest, and then we'd have had to pass CPR instructions.
Your ambulance has just arrived.
They're there, are they? I'll wait until they're with him, OK?
Yeah. Right, the paramedics have literally 20 feet away from me now, just walking up.
OK, I'll leave you with them then, OK?
OK.
OK, take care.
And you, thank you.
Do you have any guilty pleasures?
I like watching some really dark programmes, documentaries. Yeah. It could be murder ones, it could be... Even if it's like fiction, but I more like the ones that are to do with real murder
True
cases
crime.
and things like that. True crime, yeah.
Do you find these sort of murder documentaries quite addictive to watch?
I do. I think they are just, I don't know why.
Like binge-worthy?
Totally binge-worthy.
Another one, then one more, I need to watch one more.
Yeah, can't stop.
Yeah.
Oh, look, it's really late. Oh, no.
One more.
No sleep.
Ambulance service, patient breathing.
Yes, but she's gone all very funny. She don't know where she is. She's just lay here all mesmerised.
And is she a diabetic?
Yeah, she is diabetic.
We're going to category 2, staring blankly, warm to touch, previously diagnosed diabetes, and behaviour change. Patient is in a state of confusion, staring blankly. I wonder if they're having a hypo.
Yeah, sounds like it, doesn't it?
Yeah. When reading the notes on the way to this job, in your head you're thinking, could this be a diabetic hypo? So that means when somebody's blood sugars become so low that they start to become unresponsive, which could potentially lead to them going into a diabetic coma.
Diabetes is a nightmare, isn't it?
I'm going to guess their sugars are really low.
Yeah.
Hello. Is it Barbara?
Everybody's here.
I'm Danny and this is Lisa. How can we help you this evening? Feel of your wrist.
I just went funny. I couldn't speak properly. All my words were robbled up.
Okay.
But I still don't feel right.
She was really struggling to get any words out at all. But when they came out, I hadn't got a clue what she was talking about.
It just didn't really make sense.
No.
And what time would you say that was?
A couple of hours ago.
A couple of hours.
Earlier this evening, 85-year-old Barbara started slurring her words. As her partner John is hard of hearing, a friend rang 999.
Have you had any tingles or any weaknesses in your arms or legs? No. Do you have a headache or does it feel fuzzy?
It's a bit of a headache.
Yeah. Do you mind if I get a drop of blood from your finger as well? If I have this one, then you can pinch it. Yeah. Ready? 7.6.
As Barbara's blood sugars are normal for a diabetic, something else must be causing her confusion.
I'm just going to do a few checks on you, so if you just take my hand and then give my hands a good squeeze. As hard as you can. That's it. And then push me away and then pull me towards you. Lovely.
Danny carries out a series of tests designed to see if Barbara is having a stroke.
So when we do a fast test, this is when we're doing lots of pushing, pulling, checking strength, we're doing lots of silly faces. This just checks to see if there's any weakness on one side, which could then potentially show us that somebody is having a stroke. Puff your cheeks out, and then poke your tongue out, and then side to side. Lovely. We'll just do a few checks on you as well. We'll do your blood pressure, check your heart rate and your temperature.
Okay.
And do you say you've still got a bit of a headache now?
Just a little bit.
So the fact that Barbara had a headache could be an indication that she was in fact having a stroke. It certainly is one of our red flags.
So at the moment, your blood pressure is very, very high, and it's 212.
If you didn't live in Wolverhampton, where would you live?
In the UK, it would be London. Abroad, it would be Australia.
Yeah, I'd be Australia for me, I think. Wake up, go for a surf.
It'd be amazing.
I don't think there's any similarities between Australia and Wolverhampton.
Wolverhampton's Wolverhampton. And Australia's Australia. Like Australia, mate. And you've got beaches.
You ain't got no koala bears in Wolverhampton.
Nothing.
Ambulance service, is the patient breathing? Yes. And what's the reason for the call, please? Asthma attack. She's struggling to talk. How old's the patient, please? 10.
We're going to Cat 1, life-threatening asthma.
82.
82, thank you, just category 1, female patient, 10 years of age, asthma,
10. Just ask for the age again.
Yeah, can you just repeat the age again, please?
10, 10.
When you hear life-threatening asthma in 10-year-old, the alarm bells do start ringing. You start having to think about what we're going to walk into and what we're going to see.
We're just pulling up.
Hello. What's your name?
Ella. My name's Courtney. Are you mum? Yeah. What's happening today?
She spoke about 1:45 and obviously started coughing and having an attack. She's had 15 puffs in the space of 45 minutes and she's been saying it's still coughing. It doesn't seem to be settling. She feels like it's getting worse.
Okay.
10-year-old Ella was diagnosed with asthma at the age of 2. Tonight, when she was having an attack, Mum Joanne called 999 as Ella's inhaler wasn't effective.
She's quite a bad asthmatic. This is the third attack this year.
What normally happens?
Normally she responds quite well. This is the first time where it's kind of not worked effectively.
Can I listen to your chest?
Seems to struggling to talk.
It's quite worrying that Ella wasn't reacting well to her treatment. It means that her inhalers aren't working and can be a sign that her asthma attack is going to get worse and can be quite bad for her health.
Breathe normally for me, sweetheart. That's it. Can you sit forward for me so I can listen to your back? That's it.
Asthma is an inflammation of the airways causing them to narrow. It's the most common chronic disease among children like Ella.
That's lovely. When was the last time she had a puff?
Probably just before, as you was here outside.
Any of your friends been unwell?
I have. I was unwell last week. I noticed after school she said she was a little bit coughy, weren't you? But nothing major.
I'll pop some stickers on your wrists.
Do you like school? Yeah.
I know what she likes. Squishmallows.
Oh my. Look at these. It's quite heavy. It is quite heavy, actually.
There's
They're all
more?
coming out of everywhere. She had loads of squishmallows, didn't she?
I think you talked to her most about them because she was quite quiet, wasn't she?
She soon opened up when she was
loved
talking
them.
about them. She did love. I love them.
I've never
She
seen
had so many. Which is your favourite?
That one down there.
That one. How are you feeling? Better. I was quite relieved that Ella's asthma attack had calmed down quite significantly. I couldn't imagine what Ella and her mum was going through though when she was fighting for breath. All your observations and everything are okay. What do you want to do today? It's entirely up to you. So at the moment, everything's spot on.
I think we'll monitor at home. The cough's kind of hopefully stopping now.
Do you want to get out of bed and have a little walk around? Yeah? Just to see if sort of getting up and about just sort of aggravates anything, that's all. Ultimately, we need to see Ella get up walking about because kids compensate quite well. So she was sat in the bed, quite comfortable, but we need to see any changes.
Any exercise can sort of aggravate asthma, so if we get her to walk about, we can monitor her oxygen levels, make sure that they don't drop.
Hello.
I'm missing dog time, but
You're going to have belly tickles.
I'm in love.
He's very friendly. So
You are so handsome.
The dog was the cutest.
One of my favourite things about the job is...
The dogs.
Yeah.
How are you feeling?
Better.
Better. Do you guys have any questions?
No,
happy.
no, yeah.
So happy to stay, happy to monitor.
Yes.
We'll leave this sheet of paper here. It's got all your observations on, okay, which are all normal. But yeah, happens again, you can always call us back. Right, we'll leave you to it, okay?
Yeah, that's great.
With Ella's breathing under control, Courtney and Parker are happy to leave her at home. Mum knows that if her symptoms get worse, she can always call 999 again.
When we had this speech issue, did we have any facial drooping when it happened? No.
To the north of Worcester, Danny and Lisa are with Barbara, who's been experiencing stroke-like symptoms.
So everything was fine, it was just the muddled speech.
I didn't notice that, it was just a speech.
Okay. With this speech issue, it could have been that you potentially might have had a TIA.
A temporary disruption in the blood supply to part of the brain is called a TIA, or mini stroke.
Yeah. So it could be that you had like a blockage in your speech, but you didn't have any of the other symptoms, and then it's resolved. But obviously you've still got the headache and the slight blurred vision.
Yeah.
But with your blood pressure being that high, it would be wise to go and see somebody tonight.
Yeah. It was really important that Barbara came to hospital with us. Although her symptoms had resolved, her blood pressure was significantly high, giving her a massive risk of having a really big stroke.
Thank you. Right, let's go. I'm ready when you are.
Lisa and Danny head off on the 17-mile drive to the Alexandra Hospital in Redditch.
You say you both worked together?
No. I was in the operatics and you were in the operatics.
Yes.
And he was a singer, so that was how we got together.
You say you've been together how long?
27 years.
Oh, that's nice.
And it don't see my eye too much.
I think we're just pulling in now. Bit bumpy.
In hospital, Barbara will have tests to see what's causing her extremely high blood pressure and confused speech.
You okay wearing a mask in as well? Just in case.
Tests showed that she was having a TIA, or mini stroke, as Danny suspected. After 24 hours, Barbara was back to her normal self and able to go home. Gerald, who fell out of bed and had a high temperature, was diagnosed with sepsis. He was given antibiotics and spent 10 days in hospital. And Charlotte, who was in agony with a rare stomach condition, spent 19 hours in hospital.
I was diagnosed with sphincter body dysfunction in 2018. This condition has a huge impact on my life. More than anything, it makes you feel like you're a failure as a parent, because I can't do as much as I really want to with my children. On the day that the ambulance crew were called out, I'd already been crying for 5 days and spent 5 sleepless nights and just curled up in bed. I've learned that over the 6 years of being sick to try and deal with these flare-ups.
Charlotte has developed different coping mechanisms to help her live with this condition.
I've always been an artist, so I paint as much as I can and draw as much as I can, and it helps with distraction and things like that from the pain.
Next time, the paramedics are involved in their own emergency.
Stay. It can be very dangerous driving on blue lights. You're always having to be on high alert of what other people are doing, as well as having control of the vehicle.
A woman is lapsing in and out of consciousness, but refuses to go to hospital.
I want you to listen to me, OK? You need to have your head scanned. This is not normal.
She's gone. You do think the worst for somebody to be taking blood thinners to then be unconscious due to a head injury, and there is a high possibility this patient has got a bleed on the brain.
And a new patient is born.
Just got the forward motor today.
I think Gemma was amazing. She was very brave and calm in that situation.